Okay, it's now 3 minutes past 1:30 Central Time, so perhaps I will begin. I'm Tyler Vanderweele at Harvard University, and will be speaking today on the causes, consequences, and measurement of meaning. I will structure my presentation as follows. I will first begin with some discussion of the relation between flourishing and meaning, a point to which I will return at the end. I'll draw some distinctions between meaning and purpose, and then I'll focus a fair bit of my presentation on the empirical study of purpose, where there has been, I think, greater attention than the broader construct of meaning, looking both at the effects of purpose on subsequent health and well-being, but also the factors that seem to shape one's sense of purpose in life and how that might vary by life stage. I'll use some of that to also motivate questions with regard to deeper, more adequate measurement of meaning, and make some final remarks on the relation between meaning and transcendence. I do want to thank collaborators in this work: Eric Kim, Ying Chen, Jeffrey Hansen, and others at the Human Flourishing Program at Harvard University, along with funding from the John Templeton Foundation. And before I begin with the formal part of the presentation, I do also want to acknowledge I am not a logotherapist or any sort of therapist myself. I really am an empirical researcher, and I'm certainly not an expert on the life or thought of Viktor Frankl. I've read his book, Man's Search for Meaning, a couple of times, but again, can't claim any deep expertise there. And while my empirical research is oriented towards the study of different aspects of flourishing, including meaning and purpose. Meaning and purpose in and of themselves are not particular areas of expertise, sort of one of many different aspects of flourishing that I try to study. But nonetheless, I'm very grateful for the opportunity to be here to present today some of the empirical work we've been doing, and also my own reflections on this topic of meaning and purpose. So what does a flourishing life look like? I'd like to begin with that question and situate meaning and purpose in that broader context of flourishing, and I will return to this at the end as well. And while I do think notions of flourishing will and do vary across different individuals and religious and philosophical traditions, I think any reasonable conception of flourishing would include the following 5 domains of human life. Not that flourishing is reducible to these 5, but I think any sensible conception would include these. And these are happiness and life satisfaction, physical and mental health, meaning and purpose, character and virtue, and close social relationships. Again, I don't think these things exhaust flourishing, but each is I would argue, a part of it. I think each of these domains, including that of meaning and purpose, satisfies the following 2 criteria. I think each is nearly universally desired. We have some empirical data on that now as well. And each is an end in and of itself. It's sought for its own sake and not merely as a means to some other end. And I tend to think these 2 criteria of being really universally desired and being an end might sort of help shape consensus around what to measure with respect to flourishing. We've put forward a brief measure of flourishing in this paper in the Proceedings of National Academy of Sciences, which we've been using in quite a bit of our empirical work. But again, centrally here, I think meaning and purpose is one of those critical central domains of human flourishing. And I think it's important to distinguish these domains. They really are not interchangeable, because they can have different effects, and they can have different causes. As sort of one example, during the COVID-19 pandemic, if we look across the different domains of flourishing, we see perhaps unsurprisingly rather large declines in happiness and health and financial status, but much smaller declines in other aspects of flourishing, and less substantial declines, for example, in meaning or in our character assessments, or perhaps somewhat surprisingly in social relationships. People have found ways to connect in spite of the restrictions, it seems. And likewise, the these domains vary in terms of how life course trajectories take place. They vary with age. If one looks at sort of happiness and life satisfaction, one often finds that is in fact increasing with age, often up until the person's 80s it increases. But the story is different with purpose, for example. While life satisfaction tends to increase with age, purpose does not. The general trajectory, perhaps starting mid to late 60s, and perhaps in line with often with retirement, is a decline in the sense of purpose. So these really are not interchangeable constructs. Likewise, I would argue that meaning and purpose really shouldn't be used interchangeably, even though they often are. Sometimes these terms are even conflated with life satisfaction. As one example, the purpose and life test, which was a widely used assessment of purpose and sort of grew out in part of logotherapy and Viktor Frankl's work. Some of the items in this assessment, I think, don't really concern purpose and meaning, but really are more relevant to enthusiasm or excitement or satisfaction. Not all of them. I think there are many good items in this purpose and life test, but also some questionable ones, including things like I'm usually enthusiastic. I mean, is that really what we mean by purpose? Or my life is running over with exciting things. Well, excitement might be a source of meaning, but not necessarily coincident with it. Or I feel really good about life, which might tap into meaning and purpose, but again, might also tap into life satisfaction. So again, I think distinctions really do need to be drawn. We've seen this already with life satisfaction and purpose concerning the relationship with age. And it's important to distinguish these because these different phenomena related to these different constructs may have different causes and different consequences. And so likewise, I think similar distinctions should be drawn between meaning and purpose. I think purpose is more volitional, more end directed, whereas meaning is more cognitive and really concerns understanding the broader context of things. And if one turns to the empirical research with that distinction in mind, one realizes that most, though not all, of the empirical research really concerns purpose rather than that broader context of meaning. And I think this is important because I think further work and refinement is needed on the measurement and assessment of meaning. And again, I'll come back to that point later in the presentation. But for now, I will focus on our own empirical research and that of others on this topic of purpose. And then after go through some of the results, I will return sort of back to this distinction between meaning and purpose, and whether perhaps even more fine-grained distinctions might be worthwhile and valuable. So I'll begin with question kind of how does purpose in life shape subsequent health and well-being? And we'll run through some analyses from longitudinal data collected over time on the same set of individuals from the health and retirement study, looking at the effects of purpose on smoking, on alcohol consumption, physical inactivity, sleep problems, healthy body mass index, longevity, mortality risk, and various aspects of psychological well-being also. And importantly, I think in the study of just about any psychosocial construct, but including purpose and meaning, if we're going to try to provide evidence for causality, for the effects of something or the causes of it, we really need data over time. We need longitudinal data because otherwise it really is difficult to, or often impossible to distinguish the directionality of cause and effect. We need data over time on the same group of individuals. And so, as an example, one finds volunteering is associated with purpose. But just with that association, one might wonder, well, is it that volunteering helps create a sense of purpose, or is it that those with a sense of purpose are more likely to go on to volunteer? If data is all collected just at the same time, there's no way to tell. What we want is longitudinal data over time, where we can look at how, say, volunteering at a given time point affects subsequent purpose while controlling for baseline levels of purpose in life. And so got a short piece in JAMA Psychiatry on some of these principles of causal inference, pointing really to the need of longitudinal data. But one of the advantages of this health and retirement study is it provides this longitudinal data. And a sample of about 13,000 individuals, roughly nationally representative of the United States, began in 1992. People were about aged 50 to 55 at the beginning, with questionnaires every 2 years and numerous assessments of various psychosocial, demographic, medical, and health factors. And one of the assessments here was on purpose in life, using Carol Riff's purpose subscale from her psychological well-being measure. I mean, I think some of these items are good, some of them perhaps more problematic, some of these are reverse coded, but as examples of ones that are perhaps tapping into that construct of purpose. I'm an active person and carrying out the plans I set for myself, and I have a sense of direction and purpose in life, and rated by individuals from strongly disagree to strongly agree. So these analyses looked at individuals who were healthy at baseline, non-smokers, physically active, moderate drinkers, no sleep problems, healthy BMI, and sort of followed these individuals up from roughly 2006 to 2014, while controlling at baseline for a number of demographic factors: age, sex, marital status, health, insurance, socioeconomic status, along with baseline health, baseline depression, and baseline measures of the different psychological outcomes, to try to assess how is purpose in life, controlling for everything else, associated with subsequent health and well-being, while controlling for those same baseline levels of those same health and well-being variables. And what one finds is that purpose does matter. Purpose shapes health behaviors. And again, this is controlling for those same health behaviors at the beginning, but over time, looking at comparable people at the beginning, those with high levels of purpose, subsequently 8 years later, were less likely to be physically inactive, about 21% less likely to be physically inactive, about 30% less likely to have sleep problems, about 20% less likely to have an unhealthy body mass index, about 30% less likely to be smoking, again, controlling for baseline smoking, though essentially almost no effect on drinking, and this has sort of been replicated in other studies as well. So purpose in life does shape health behaviors. And it turns out those health behaviors, and probably also one's psychological state, one's desire to keep going to achieve those purposes, translate also into a really profound effect on longevity, substantially decreasing mortality risk over this follow-up period. So if one looks at those in the highest quartile compared to the lowest quartile of purpose in life, you find that those in the highest quartile are about 47% less likely to die during these years of follow-up than those in the lowest quartile. So this is a pretty substantial effect. Other studies just kind of dichotomizing, comparing high versus low purpose have suggested maybe a 20% reduction, looking at less extreme comparisons. And this has now been established in meta-analyses even of studies looking at the relationship between purpose and longevity, but pretty well documented now. Purpose helps to keep one alive, controlling for baseline health. Likewise, we find pretty strong effects on various aspects of psychological well-being and psychological distress. And this is once again controlling for baseline levels of these psychological factors. So this is looking at how these how purpose in life shapes these aspects of well-being over time, looking at people who are comparable at the beginning. But these are standardized effect sizes. So sort of can be expressed in terms of standard deviations. For those less familiar with the statistical literature, you can almost think of these here as sort of being 58% higher, likely 58% more likely to have high levels of positive affect and low levels of negative affect, these 4 or 8 years later. So pretty substantial effects on increasing positive affect, life satisfaction, optimism, mastery, slightly more modest, but still very meaningful declines in depression symptoms, hopelessness, negative affect, declines also over time, these 4 years in loneliness, and an increase in more objective reports of social integration. So purpose in life really contributes to health and well-being quite profoundly in a number of different ways. If we could improve purpose in life, it would go on to have ripple effects in improving health and well-being. We can also use this sort of data over time to turn the question around. Previously I was looking at how purpose shapes a variety of health and well-being outcomes, but we can instead ask the question, well, what might contribute to purpose in life? What in 2006 might affect purpose in life later on? And we can look at a variety of different exposures or phenomena or factor. The actual design we used in this study was we controlled for kind of a host of things, social, demographic, health-related variables in 2006, looked at kind of one at a time, controlling for everything under the sun. How did the different factors in 2010 then go on to shape one's sense of purpose in 2014, having controlled for purpose in life in 2006 as well. So looking at people who are comparable at baseline in purpose, and then looking at how changes in different exposures or phenomena would go on to increase or decrease subsequent purpose. So this is using the same data, but using it in a different way to try to look at what increases and decreases purpose. Once again, this is for an older population, and I'll come back to this point because I do think life stage and context really does matter here. But for this older population, what we found is that there are quite a number of phenomena or exposures that lead to decreases in purpose: a stroke, diabetes, poor physical function, poor cognitive function, poor hearing, chronic pain, depression, anger, perceived constraints. All of these pretty strong evidence that these decrease purpose over time. And in these analyses, we found far fewer for this older population exposures that led to increases in purpose, things like volunteering or helping others, or physical activity or positive affect led to increases in purpose, usually pretty small, kind of effect sizes, standardized effect sizes around 0.1, so a lot smaller than the effects we found of purpose on other things. It seems to be more difficult to change or shift purpose. But because there are far more exposures, at least in these analyses, that seem to decrease purpose amongst older population rather than increase purpose, that might explain some of what we saw with regard to the relationship between purpose and age, that it was tended to be declining over time. If one does similar analyses, looking not at purpose, but at life satisfaction as the outcome, you actually find far more factors that increase life satisfaction with the same data, same population. We find, not just a few things increase life satisfaction, but many: physical activity, living with one's spouse, positive support with one's spouse, positive support from children or family or friends, religious service attendance, volunteering, helping friends, neighbors, or relatives, mastery, social status. All these things increase life satisfaction. And so again, this discrepancy, finding more factors that increase life satisfaction in older age than purpose, once again, may explain some of those differing relationships with regard to purpose in age versus life satisfaction with age. Also, some of the things appear on both lists as factors that shape both purpose and life satisfaction, such as helping friends and neighbors or physical activity. But often the effects on life satisfaction are much larger, often twice as large or more as they are on purpose. Life satisfaction seems to be more malleable. The one interesting and important exception is volunteering, where it did have effects both on purpose and on life satisfaction, but it was sort of essentially the only variable here where the effects on purpose in life were larger than on life satisfaction. It increased both, but life satisfaction by only about 0.7 standard deviations, whereas purpose in life by about 0.15 standard deviations. Still not huge effects, but but kind of one interesting exception to this general phenomena of it seemingly being easier to change life satisfaction than purpose in life. So, obviously with empirical research, one wants to replicate in different populations, different studies, different measures. But what these analyses suggest, and we replicated this with another in another study of nurses, the Nurses Health Study 2 data using very similar design and likewise very small effect sizes, not many factors changing purpose, but seem to corroborate this idea that purpose, at least later in life, seems to be more difficult to change. It's easier to change life satisfaction. And sort of the experimental work that's been done on this with regard to trying to design interventions to alter purpose in life and life satisfaction have also differed. There are quite a number of interventions that seem to be effective at changing life satisfaction, ranging from things like expressing gratitude to showing acts of kindness. These things really do strong evidence experimentally in randomized trials that these things increase life satisfaction, whereas many of the randomized trials for interventions for purpose in life have in fact failed. Again, I think reinforcing this idea that life satisfaction is easier to change than purpose. Again, I think one potentially promising exception is volunteering. Discussed earlier, the effect sizes are relatively modest, but it's easy to implement, and there are clearly benefits to the participants, including in some of our other studies beyond just purpose in life. But benefits also to the community. So I think in terms of trying to foster purpose in life, at least with older populations, volunteering might be one effective way to do so. Probably still need very large randomized trials to definitively establish this. The existing ones probably haven't been large enough to detect these more modest effect sizes, but I do think this is a potentially promising venue for intervention. But an important caveat in all this work I've presented thus far is that it really does concern an older population, and effects and dynamics can differ by life stage. And some of our other work has in fact suggested that purpose in life may be more malleable at younger ages. It may be easier to change, to develop a sense of purpose in life at younger ages. And so we did a similar analysis using the Growing Up Today study, a study of adolescence and then on to young adulthood of about 9,000 individuals with 6 years of follow-up data. And we found more factors associated with purpose, subsequent purpose, in this study of adolescents and young adults than we found with the older population. Also, a much larger effect sizes as well. Again, with the older population, even when we did find an effect, it was small. It was about 1/10 of a standard deviation. And here we're finding more like a third or even a half of a standard deviation. So in this study, several phenomena or exposures seem to powerfully affect subsequent sense of purpose or mission, including religious service attendance, which increase the odds of subsequent sense of mission by over 50%. Maternal attachment, fairly substantially as well. This is kind of reported per standard deviation of maternal attachment. Volunteering, just like the study of older adults, so also with younger adults, seem to powerfully shape purpose. And then in this study, also some factors which seem to decrease the sense of purpose over time, including depressive symptoms and marijuana use. So effect size is much larger here. And I think, again, this work needs replication, but and I think what these results preliminarily suggest is that from a societal perspective, it might be good to sort of try to focus on helping shape a sense of purpose earlier in life. Purpose may be more malleable earlier in life than later in life. So I mean, I've been presenting some preliminary empirical analyses. Others have I think worked on these questions and I think suggesting somewhat similar results. But there's a lot still to learn. I think especially with regard to a life course perspective, and also because all of this I've been presenting so far has really been on purpose rather than meaning, rather than understanding or having a framework for conceptualizing the broader context of one's life and one's activities. One of the motivations for the forming of the Human Flourishing Program at Harvard was that really we need more rigorous empirical work on these different aspects of flourishing, including meaning and purpose. I kind of wondered, why do we know so much more empirically, at least, about the determinants of cardiovascular disease than we know about the determinants of what gives rise to a sense of purpose in life, despite that being desired by just about everyone. And I'm all for rigorous study of cardiovascular disease, but I think we should be applying the same rigorous data and methods to study the determinants of purpose and of meaning. And I think especially on this topic of meaning, more work remains to be done. I think some of this might be related to trying to measure meaning versus purpose, and we do have some some reasonable measures of purpose, I think, but further refinement, I think, can be done. And so we recently introduced what we're calling the comprehensive measure of meaning, which I'll briefly describe, and appears in this book just out this year, Measuring Well-Being, from Oxford University Press, which came out of a conference we had hosted some years ago. It's open access, so you can download it from the Oxford University Press website, or this particular chapter of the book on the comprehensive measure of meaning from our website as well. But this measure distinguishes between what has kind of come to be a reasonably widely accepted tripartite distinction in the psychology literature between purpose, which is sort of more end-directed, coherence, which is really cognitive, having a sense of the meaning of life, say, and significance, finding meaning in life. But we also used distinctions in the philosophical literature to provide further nuance between these different domains of coherence, significance, and direction. So with regard to coherence, we distinguish between global and individual coherence, sort of understanding life as a whole, the origin of the world, what is not valuable, and one's final end, sort of a big picture of an understanding of the universe from individuals' coherence, which is really more an understanding of oneself, who one is, one's identity, what it is that one values, and how it relates to one's understanding of the world. And while the two are probably going to be correlated, one could imagine scenarios where one is high and the other is not, for example. And with regard to significance, we again drew distinctions in the philosophical literature between subjective significance and objective significance. Subjective significance is finding one's activities worthwhile. That really, in some sense, only depends on one's state of mind. If one finds counting pieces of straw worthwhile and meaningful, that's one state of mind, and so be it. But that can be distinguished between more objective notion of significance, sort of having achievements or contributions or activities that are either objectively valuable or perceived as valuable by the relevant community. And then likewise, with regard to purpose, or what we're calling direction, I think there are different levels of a hierarchy which one might distinguish. Sort of the lowest level goals, just something one desires to accomplish. At the higher level of purpose, sort of a life aim that generates and organizes those lower level goals. And then possibly finally a sense of mission or calling, a unified understanding of what one's life should be, and that goes on to generate and guide all of one's activities and goals and purposes, and perhaps adjudicates between them when they come into conflict. So for this measure, which is a measure of kind of having meaning and purpose rather than sort of seeking it or having accomplished one's purposes, but this is kind of having meaning and purpose. We again use this tripartite distinction with these finer classifications for these 7 different subdomains, with 3 items in each of these domains, really drawn principally from existing items that had seen prior use, we sort of formed a catalog of 700-800 items and tried to organize them with these finer grained distinctions in mind, and then chose 3 items in each of these 7 domains for this comprehensive measure of meaning, occasionally modifying the items if there was ambiguity or if no adequate items existed. So I'll just very briefly walk through what these are so you can kind of get a sense as to how we're trying to now go about the measurement of meaning and purpose, and certainly these would benefit from yet further refinement still, and there may be further refinements that are necessary and revealed when we do psychometric testing. But these are the items sort of scored once again on a Likert scale of strongly disagree to strongly agree for each of those 7 domains. For global coherence, a clear understanding of the ultimate meaning of the world, the meaning of life in the world around us is evident. To me, I have a framework that helps me understand or make sense of human life. So again, a global understanding of the universe, what's happening in the world, of human life itself. And then that's distinguished between individual coherence, which is sort of the individual's understanding of their identity and of the events in their life and of who they are. So I understand my life's meaning. I can make sense of the things that happen in my life. I have a philosophy of life that helps me understand who I am. Then with regard to significance, sort of finding meaning in life, with subjective and objective significance. On the subjective side, I'm living the kind of meaningful life I want to. Living is deeply fulfilling. I feel like I found really significant meaning in my life. Kind of looking at activities, the kind of life that one has, the process of living itself. And then with regard to objective significance, things I do are important to other people. I've accomplished much in life as a whole. I make a significant contribution to society. And then with regard to direction, this is often what's referred to as purpose, but because we're trying to distinguish between these different levels of the hierarchy, goals, purpose, mission, we've kind of chosen to use direction rather than purpose as the broad category for each of these 3 subdomains. So kind of at the lowest level, goals in my life, I have clear goals and aims, goals in life that are very important to me, definitive idea of things I want to do, sort of an understanding of the goals, having the goals, and then a relation between one's activities and the goals. Purposes, this is a similar structure. I have a sense of direction and purpose in life. I can describe my life's purposes. My current aims match with my future aspirations. So once again, having purpose, understanding the purpose, and then aims that are in alignment with one's purposes. And once again, similar structure with mission or calling. I've been aware of an all-encompassing and consuming purpose towards which my life has been directed. I have a sense of mission or calling. I have a mission in life that gives me a sense of direction. So once again, having that sense of mission, understanding it, and sort of alignment with one's purposes. So this is now what we're trying to do in sort of our new empirical work on the study of meaning, this 21 item measure and the comprehensive measure of meaning. And if one compares this to kind of some of the currently widely used assessments for meaning and purpose, we've kind of mapped for some of the more prominent measures currently in use in empirical research, what each of these does and does not capture if one moves towards our more fine-grained distinction. And most of these do have goals and purposes, but only a few have that broader sense of mission. Some of these capture subjective significance, some objective, but none of them really capture both sides of this. And then while some, though not all of the assessments involve some assessment of individual coherence, really none of them have items, none of the major ones used at present, capturing a global sense of coherence. So again, I think that items in many of these scales are really valuable, and sort of the Georgian Park one certainly also captures all 3 of coherence, significance, and purpose or direction. But if one wants to make these finer grained nuances. None of them quite is satisfactory, but the comprehensive measure of meaning really was designed to try to look at all 7 of these subdomains. So we've currently collected data on this comprehensive measure of meaning in a sample of 4,000 undergraduates at the University of British Columbia and 9,000 participants in Mexico, and we're in the process of evaluating the psychometric properties of this measure. And sort of interested over time with the University of British Columbia sample, we have a second wave of data now. So we can begin to look at things like how do the dimensions of meaning and purpose relate to one another. Over time, we'll be able to look at, do these different dimensions have different effects on health and well-being? Are there determinants different over time? And with some of the more generic measures sometimes being used, like my life is meaningful, or I feel my life has a sense of meaning, we'll be able to look at correlations between those more generic items and these 7 different subdomains to see what's really shaping people's responses to these more generic questions. So, and more information here in the paper itself on this comprehensive measure of meaning. And again, this work is still at an early stage, so it remains to be determined whether these distinctions will necessarily matter empirically. But they think there's some preliminary evidence that they might. And a couple of our literature reviews, I think there's some evidence, I wouldn't say definitive, but some evidence that purpose in life, that indirected, more volitional aspect of meaning, may be more strongly related to all-cause mortality, to longevity, to survival, than is the more cognitive coherence, say, with respect to meaning. And when I went back over my notes from Frankel's man's search for meaning, my sense was that he in fact grounded in many of his statements that notion of survival principally in purpose, but perhaps others who are more familiar with his work could comment on whether or not that is indeed so. But again, I would say this literature review is only preliminary. Empirical research really is only as good as our measures are, and it's possible we just haven't yet been using adequate measures of meaning. And sort of results may differ with better measures and assessments of meaning. Once again, most of the prior empirical research has really been on purpose rather than a meaning. But it will be interesting to see over time whether the determinants of meaning, of say coherence and significance, or these different subfacets of it might be different than purpose. And I think it's possible that context matters as well. A lot of the studies that we've been doing have just been with kind of the general population, and the health and retirement study was roughly nationally representative of the United States, rather than necessarily those who are confronting some major struggle or adversity, or who are going through suffering. So one might anticipate that relationships would differ if say one restricted attention to those going through intense suffering. So again, empirical research is really only as good as one's measures are, and this pertains both to measures of meaning and purpose itself, and sort of these finer grained nuance distinctions we're trying to draw between purpose and different aspects of meaning. But also the empirical research is only as good as the the exposures and outcomes under study, and sort of time spent in reflection, say, or at leisure, or more nuanced assessments of religion and spirituality are absent from many of these large cohort studies. So really, in terms of trying to understand what shapes meaning and purpose, we need to be cognizant and aware of what is not present in the data. But again, I do think the empirical research can at least give clues potentially to the fundamental causes that give rise to, that shape meaning and purpose. One might try to extrapolate. This is, admittedly an extrapolation, but one might try to extrapolate from the more concrete measures and assessments we have to sort of broader constructs which might themselves be more powerfully related to meaning and purpose. So we found evidence that volunteering shaped a sense of purpose, and maybe that's corresponding to broader notion of offering of love to another. We found in our study of the growing up today population that maternal warmth or love gave rise to a sense of purpose or mission later in life. Perhaps the experience of love helps give rise to meaning, to purpose. Religious service attendance shaped subsequent purpose and mission, and maybe that's really corresponding to an experience of, within community, a love of God. So, well, the focus of much of my own work is empirical. I do think we need to supplement that empirical work and interpret it through philosophical, theological, and theoretical lenses to come to a deeper and better and more holistic, integrated understanding of the causes and consequences of meaning and the context in which they're relevant. And so, with regard to what that empirical research might possibly point to, I'd like to make a few concluding remarks and reflections on my understanding of the relation between meaning and transcendence. If meaning itself is really pertains to understanding the broader context of things, then it may be possible that the greatest meaning is found in the broadest context, in the highest, most ultimate context, by making appeal, for example, to the transcendent. And so, in these next two slides, I just want to offer my own reflections in that regard, with respect to what is it, certainly in my life, and I think the lives of many others, that does and that can powerfully give rise to a sense of meaning. I think with that appeal to the transcendent, to God, a theistic account can provide an important foundation for meaning. That sort of meaning in life is found in God, and the love of God, and love for God. And I think we can sort of spell that out in a more nuanced way with some of these distinctions. Coherence, the origin of the universe and of life itself, it's an act of creation by God. Direction, our purpose in life is to enter the love of God. Significance, true significance in life is found in love for God. Or, one might even use our sevenfold distinction, global coherence. The meaning of existence is to be found in God, and all things ordered to God. Individual coherence, one's own life, the meaning of one's life is having been created by God, being loved by God, is one's final end in God. Subjective significance, one finds meaning in life subjectively by realizing and contemplating one's end in God and one's activities oriented to God. Objective significance, one finds meaning objectively in carrying out actions that orient all things to their proper end in God. And then likewise with mission, purpose, goals, one's calling in life to orient the whole of one's life. It's God, one's purposes include various aims that objectively and subjectively realize the meaning of one's life as oriented to God. One's goals include practical aims to orient one's life to God. And again, I think this is kind of broadly theistic understanding. I think potentially applicable, say, to Jewish and Muslim traditions. One would want those expert in those to comment on what here would be relevant or would need to be modified. Tradition, the Christian tradition, I think an understanding of like this is roughly consistent with the Christian faith itself. I think an explicitly Christian understanding would be that orientation to God, underlying meaning and direction, is really accomplished by turning to a union with and an imitation of Jesus Christ. That would be kind of explicitly Christian understanding of this more theistic foundation to meaning. I think such an understanding might also help facilitate finding meaning amid suffering. A lot more could be said here than I have time for, but I think suffering itself might be understood as providing a context or an opportunity to turn one's will to God, to reorient one's life to God, an invitation to do so. Again, a lot more could be said. These are just some preliminary reflections coming out of my own life, my own experience, and also what I think perhaps the empirical research might be pointing to. Is there any empirical evidence for these claims of kind of a theistic understanding of meaning? giving rise to a sense of meaning and purpose? Does that transcendence facilitate meaning? Does it facilitate flourishing? Again, I think the empirical research can at most provide pointers or suggestions, but with regard to religious service and attendance in particular, which arguably both includes a religious and transcendent element, but also a community element, and both of which I think are capable of generating meaning. I think the evidence is substantial. There are numerous longitudinal studies, with rigorous data and methods that indicate that religious service attendance itself is associated with less depression, less suicide, greater longevity, greater life satisfaction, greater meaning and purpose, less substance abuse, less crime, less social relationships, greater marital stability, more generosity, volunteering, civic engagement, pro-social behaviors. Doesn't affect all outcomes. Incidence of cardiovascular disease and cancer is less clear. Anxiety, surprisingly, evidence I would say is much less clear, but a large number of flourishing outcomes, including meaning and purpose, evidence that religious service attendance, which again arguably combines both the communal and the religious components, positively affects meaning and other aspects of flourishing. And other kind of religious spiritual variables are much more weakly associated with these outcomes than is religious service attendance itself. Likewise, other aspects of community life, while they do affect some of these outcomes, the effect sizes are much smaller than one finds with religious service attendance. It seems with religious service attendance, it's kind of the coming together of the religious and the communal, the social, that's kind of giving rise to these powerful effects across numerous flourishing outcomes. So in conclusion, I think meaning and purpose are central constituents of flourishing, but also causes of other aspects of flourishing, including physical health and life satisfaction and social relationships. Purpose really does matter for subsequent health and well-being. It does, as we've seen, tend to decline with age, and it's not particularly easy to change, it seems, at older ages, but volunteering or loving or helping others may be a promising pathway. Purpose in life may be easier to shape and form at younger ages, and so we should perhaps take this into account from a societal perspective. And although I think we have perhaps an emerging sense as to what factors may be shaping purpose, we need more work on that. We also need more work on meaning, on coherence and significance. We need a better measurement of meaning. And again, I've provided some reflections and perhaps some very preliminary empirical evidence that a perspective grounded in the transcendent may provide both meaning and facilitate flourishing. That concludes my presentation. Thank you all for being here and listening, and happy to take any questions. Let's see. Feel free to just speak up if you're able, or you can put question in chat. Has all this information been summarized in any article or book? Again, the comprehensive measure of meaning is available in our book, Measuring Wellbeing. A lot of the empirical analyses are in individual papers that can be found on our website, and I think I do have a list of references here, but if you go to the Human Flourishing Program website, you can find all of these papers and references as well. And then the work on kind of religious service attendance, we've got a couple of summary articles, Religion and Health, a synthesis, and Religious Communities and Human Flourishing, which are shorter pieces that kind of summarize the existing evidence and many other individual empirical studies. Another question in the chat: from a logotherapy perspective, purpose and meaning are individual constructs, idiographic, but population studies are nomothetic. Does this have a significant impact on your research? Yeah, I mean, I do think the sort of research that I have been describing, empirical analyses of large cohort studies, needs to be interpreted carefully. These are population averages. These are looking at the effects of different aspects and phenomena of a person's life and how it affects outcomes over time, but they're averages, and those averages, I think, can disguise individual experience. I think this might be relevant, say, for the studies we've done on religious service attendance and anxiety, where we've, on average, found almost no effect whatsoever. So somewhat contrary to our expectations. Many people would think, well, surely if religion and spirituality are going to do anything, it's going to be giving someone a sense of peace. And with regard to normal measures of anxiety, we really don't find much on average. But I think that's probably disguising heterogeneity in experience. I think for many, their religion and spirituality do give rise to a sense of peace, do relieve anxiety. But I think for others, they in fact generate it. They generate anxiety, sort of an additional set of commitments or fear about failing to live up to the expectations one has of oneself or one's religious community. And so I do think, say, religion and spirituality bring peace for some, but it can generate anxiety for others. And so when one looks at these population averages, that heterogeneity is lost. Now, there are ways empirically with the data to look at what are sometimes called moderators or effect modifiers. If we restrict to certain subgroups of people, do we find different relationships? But that can only go so far. One tends to need very large sample sizes, and then of course you're still looking at subgroups. You're not looking at individuals, and so I do think different modes of inquiry and reasoning are important and are not interchangeable. So I think more individual-based, interview-based, qualitative work is important supplement to these large-scale longitudinal studies. While I think these large longitudinal cohort studies are very helpful from a population and societal and policy perspective, and perhaps relevant also for informing therapeutic approaches. One wouldn't want to rest the whole of one's therapeutic approach on such studies. It's simply inadequate. It does not provide the more sort of nuanced, detailed information and analysis about individual experience that one would like. Looks like another question. Can I get reference for slides 5 and 6? I'm happy to go back to those. No, slide 5. Actually, these two these two slides are for paper that's still in progress. Our paper on the determinants of purpose in life from the health and retirement study is nearly complete, but has not yet been submitted. All the other empirical results I presented are published. And sort of our analysis with the nurses' health study data on the determinants of purpose is likewise published. The study on the effects of purpose are published, but the ones looking at the determinants of purpose from the health and retirement study versus the nurses' health study data is not yet published. But I am happy to distribute the slides to anyone who would like them. Let's see. So another question that's come up as an example. We can not just encourage people to volunteer, but must help people to find volunteer activity that will be meaningful to them as an individual. Yeah, I think that's entirely true with any intervention. I think the more nuanced it is, the more tailored it is to an individual, the better. Again, the empirical analyses might help shape one's understanding about where to begin. I mean, you could look at sort of comparing those to in their 70s versus 80s versus their 90s. What sorts of volunteering activities does one group or another find more meaningful or is more able to engage in? That's still not individually tailored, but it can help provide a starting point from which one can do more individually tailored interventions. But I very much agree with the point that has been made in the chat by Michael Winters, helping people to find volunteering activities that are most meaningful to them is likely to be a good way forward. Any other questions or comments? Again, feel free to speak up if you're able, or type in the chat. Let's see, another question. Can we say that your research into the dimensions occurs in two stages, so that there's meaning and purpose, then wait, and then what is the etiology of meaning? Yeah, I mean, I think that's, you know, a reasonably good way to think about empirical research in general of psychosocial constructs. Is, you know, first we need to think about measurement, and that itself is sort of a multi-stage process where we need to, I think, clearly define what it is that we're trying to measure, come up with a construct definition, and then kind of derive from it items that correspond to the construct, and ideally clarify whether these are, you know, items are necessary, sufficient, necessary, and sufficient, or just illustrative of the underlying construct. I then go through cognitive testing. I'm asking individuals to report on the items and what thought processes they went through, and describing their responses of strongly disagree to strongly agree, and then sort of then go through some psychometric assessment of the properties of the measure empirically, and then you know, move on to etiology, kind of the study of the causes or potential determinants of the phenomena related to the construct under study of meaning and purpose, and then also its consequences. What are the effects of meaning and purpose and the sense of meaning and purpose on subsequent outcomes? And while it's helpful, I think, to kind of distinguish those two tasks, the construction of measures and then etiology, I think there probably are relationships between the two that are maybe less well appreciated in the, you know, present existing approaches. And a lot of my methodologic work right now is kind of what are the relationships between causation and measured development. I think a lot of our empirical practices now with kind of measured development center around factor analysis, which is really just looking at the relation of the indicators to one another. But one can have indicators that are strongly correlated with one another, but potentially have very different effects on the outcomes that we care about. And so how does that come into play with regard to measured conceptualization? And as an example, in using Diner's life satisfaction measure, which is satisfaction of life measure, which is one of the most widely used psychological well-being measures. I think over 30,000 citations. We find that 4 of the 5 items are very strongly related to subsequent all-cause mortality, but one of them, with regard to sort of having no regrets, if I had to live my life over, I would change almost nothing. That one has essentially no relationship with subsequent all-cause mortality. So although these indicators are, you know, pretty strongly correlated to one another, factor analysis indicates a unidimensional factor structure, they are picking up on very different facets of life satisfaction, which have very different implications for mortality risk. So to say all these indicators are interchangeable just because a factor analysis suggests unidimensionality, I think, is not adequate. They are picking up on different facets, differently related to mortality. So I think that's an etiologic study, but one that potentially has implications for measurement. And so I think the relationship between etiology and measurement sort of needs to be revisited. But at a sort of a high level, I do agree with the proposed two stages that have been put forward. I think we are now at time. I am happy to stay around another few minutes if further questions arise, but feel free to, of course, log off and move on to the next session you want to attend. But once again, it really has been a pleasure being with you here today. And again, you're welcome to download any of these papers or material from our website, and I'm happy to distribute the slides as well. But thank you all again. seeing as there appear to be no further questions, I will stop share and conclude this session. But thank you all again. Pleasure being with you. And I hope you enjoy the remainder of the conference.